We're currently operating as a shadow CCG and have been given approval to apply for full authorisation status in September 2012. If successful, we will be granted legal status to act as a statutory body responsible for healthcare from April 2013.
I think it was really good to see how many people turned out from not only the patients and public forums that exist and the patient and public groups, but also our providers. So Darrants Valley Hospital, the Deputy Chief Exec Gerard Salmon, and Annette Schreiner, the Medical Director, came along, and that was really good to see their support and encouragement.
It was good to see the appetite out there for partnership working, actually, and we were already experiencing that with our councils and with our providers, but also with pharmacists and with the patients. I think it's great to have people out there who really want to bring better quality care to patients.
What we're thinking about was using that network to arrange coffee mornings, coffee breaks where patients and counsellors, GPs can all come into the pharmacy, have a discussion about your medicines, have a discussion about all the services that are being provided in the area, getting all that feedback and passing it back to the commissioners.
It's also good to really see our patient participation groups from the GP practices present here today. And they're very vocal, they seem very active, and they're going to be good groups to work with. And hopefully as patients become more and more aware of their role, that will be a good voice for patients to be able to use, very local voice of real patients.
I think one of the key comments that came out, one of the key questions we posed to the audience was, how do you want to get involved? And how are you going to help us manage through some very challenging times, and how are you going to help us sometimes make difficult decisions? And the feedback was be very honest with us. People realise that we're living in very challenging times, and it's challenging for health and social care, and they understand that we have to provide better quality services at lower cost. But they'd rather know what those difficulties and challenges are and help to work those through with us, rather than us trying to skirt around the issue and look at different ways of reducing costs. So it's be honest about the financial challenge and let us help message that with you. We know you're going to have to make some difficult decisions, and we're quite happy to stand shoulder to shoulder with you and help make those decisions. And again, I think that was hugely humbling to hear.